Treatment. As I mentioned before, many animals self-cure, but it is a zoonotic disease, especially in dogs and cats. I think if animals come in, we are duty bound to sort the problem out, to also consider that the environment may have become contaminated, so we need to do something about that, and to warn owners to be careful about handling the animal, because microsporum and other types of ringworm dermatophytosis can, cause scarring on children's faces. So it's important we're aware of that and get the clients to seek medical advice if necessary, if they feel that they're developing lesions. As I say, often these will self-cure in humans as well, but cream will often quicken the process. So any treatment protocol for treating dermatophytosis really has a three-pronged approach. We should treat topically, we should treat systemically, and we should also treat the environment. Topical treatment. This is an interesting one. Quite often I will hear of cases where people have had a cat in, they've seen that the cat has one or two lesions on it, areas of baldness where they can see some scale and so on, and we get some of the creams that are available, the clotrimazole, the miconazole, or the terbinafine solutions or creams, and they rub it on that little area and hope that that will sort the problem out. Obviously, if this is one animal and there are a couple of lesions on it and you treat them, there is a good chance that this animal will self-cure anyway, and so your treatment was fine. In fact, it helped a bit. We could have been more thorough, but the cat sorted itself out eventually, and the treatment was fine. Obviously, we've got to be aware that the house could be infective for other people coming into it or other animals. So a new animal comes into the house 2 months, 3 months later and can develop dermatophytosis. And similarly, you could have a child coming into the house to play with one of the other people in the house, and they could develop ringworm. So we need to be cautious and careful of this. And I think when I see ringworm in a house, I really want to be very thorough and try and eradicate the problem. Otherwise, I'm afraid that it will come back. It is possible to treat the whole body. The two treatments that I'd probably recommend in this case are enalconazole, which is a Janssen product called amaverol, or obviously Malaseb has miconazole and chlorhexidine in it. And this is, both of these have been recognized in publications as being effective ways of reducing the burden of dermatophytosis actually on the animal. Controversial to clip or not, I think if you have one animal in a house that has a few lesions on it and you clip a couple of those lesions up, you treat with cream and the problem seems to go away, probably you've been okay with that. But I quite commonly see situations, referrals, where animals have not been clipped. They have been treated with various treatments. They have not got better, and it is only when I've taken these cats in and had one of my nurses clipping them out that they've really been successful. And it often then, when they have been clipped, shows that those lesions are more extensive than was at first thought. So I tend to be a vet who likes to clip cats. We do need to obviously take quite stringent precautions when we're doing that so we don't infect our own premises. But we're very careful with the staff, and I do think that that's a very successful way of quickening the process up to cure.